Some key information about the healthcare system in New Zealand. The Ministry of Health is in charge of keeping the New Zealand healthcare system running smoothly, and one way it does this is by overseeing and funding the 20 district health boards. These boards are responsible for organizing healthcare in each of the districts and meeting the standards set by the Ministry of Health. Also, public hospitals are managed by these district health boards. Public hospital care is totally covered by the government if the patient is referred by a general practitioner. However, dental health care is only free for children up to 18 years of age, while adults have to pay privately for most dental services. Unfortunately, there are no fixed or recommended fees, so the Ministry of Health recommends that you always ask about the fees for the treatment you need and be prepared to compare prices. There are private and public healthcare services, however, they are mostly public. The private healthcare services are still inexpensive, but they are not completely free like the publicly run healthcare services are. Overall, New Zealand spends about 8.7% of its GDP on healthcare every year. The funding of healthcare and the access to health professionals in New Zealand. New Zealand healthcare is a form of universal healthcare and it is funded by the taxpayers, and this makes all public healthcare services completely free to the citizens of New Zealand. Getting seen by a general practitioner is normally pretty easy unless you live in a small town or somewhere particularly remote. In New Zealand's healthcare system, general practitioners act as gatekeepers to specialists. Also, they offer something called a community service card to those who are at least 18 and receive a low to mid-level income. These cards can cover prescription fees, emergency dental care, fees for after-hours doctor visits, and at-home help.
How do you feel about New Zealand's healthcare system compared to the U.S.?
Well, I think all in all, the United States has a good healthcare system in the fact that we're one of the leaders in research and development as far as cures for cancers and all the different things like that. The reason is because we have such an influx of funds. If you go to a universal healthcare system where it's free for everybody, government supported, you're not going to have the research and development that you do now.
The education and professional training of healthcare providers in New Zealand. To be a physician, you must first complete a 6-year Bachelor of Medicine and Surgery. Then you are employed by the District Health Board as an intern or house officer. House officers complete a 2-year rotation through various health settings where every rotation lasts 3 months. After this, doctors can apply for a job as a registrar and train in that for 3 to 5 years. Once this is complete, the registrar can become a specialist of their choosing, such as general practice.
How do you feel about having a universal healthcare system?
It sounds great, and a few countries have it, but I think you only have to look at their country, their system, to see what are the negatives of it. You don't have the research and development. You have long wait times. It's just not the quality of care that you receive now in the U.S.
The cultural influences on healthcare practices and trends in New Zealand include gender, socioeconomic inequalities, and religion, just like many other countries. But New Zealand also includes a specific type of people called the Maori. They are a lower-class people that contribute to the low health status in New Zealand. Furthermore, the Maori New Zealanders make up about 15% of the entire population. They have a life expectancy of approximately 9 years less than the remainder of the New Zealander population. The country's population as a whole is about the size of the state of Colorado.
How do you feel about New Zealand's healthcare system compared to the U.S. healthcare system?
I think New Zealand and the U.S. have fairly similar health statuses, so I find it interesting that our health systems are so different. Most of their health care is subsidized by the government with few private insurance companies. I feel like this could be a good thing in some aspects, like I'm a labor and delivery nurse and in their labor and delivery hospitals, when the women come in to have a baby, it's all free. They don't have to worry about it. However, they do have to share a room with another mom, and they do have to pay for their own food the whole time they're there, and they just have a midwife instead of a labor and delivery nurse.
If you could change one thing about the United States healthcare system, what would it be and why?
I think that all of our medical choices made by the insurance company are a big problem. I don't like to know that if I need to go to a doctor somewhere, I have to check with my insurance company first. I can't just pick the doctor who I've researched and know is the best doctor for my care unless my medical insurance says it's okay for me to do so.
How do you feel about a universal healthcare system?
I like the idea of a universal healthcare system, but I don't think it really works. I think knowing that you have a problem, yet you could be put on a waiting list for that health care is something that's not good. If there's something wrong with you, I think you need to be able to get the best medical care possible as soon as possible.
Recent studies have shown that the smoking rate is decreasing, adult obesity rates have increased in recent years, heavy drinking has also begun to rise after a 6-year decline. Those living in rural areas are more at risk for smoking, drinking, and not maintaining a healthy lifestyle, and also in these areas, it has been seen that there's a high rate of depression and anxiety disorders. Despite all of these disparities, according to the 2014-2015 Annual Health Update of New Zealand, most of the population reports being in good health.